Let's get into it. As Jessica mentioned, my name is Maria Vargas, and I'm the Regional Outreach Coordinator for Eastern Oregon. If any of my community partners from Eastern Oregon are on the line, hello. Today, I'm really excited to talk to you about one of my favorite subjects, coordinated care organizations. And this is a 101 training or Monday module. So we're going to get high level and then dive a little bit deeper. But certainly there's a lot more that could be said about CCOs. But hopefully this will help you kind of wrap your head around what exactly a CCO is. So let's see what we will be learning today. We have three main goals for today. We're going to look at the big picture. What is Medicaid, or Oregon's version of that, the Oregon Health Plan? We're going to take a look at exactly what a CCO, or Coordinated Care Organization, is. And then we're going to talk about how you can engage with them and how your clients or community members can also engage with them. So that's our three goals for today. But to make this a little more interesting, a little more interactive, I did include a couple of poll questions, and this is the perfect opportunity for our first one. So I'm going to launch that, and you should see a question pop up here shortly that says, what do you know about CCOs? So I'm going to go ahead and launch that. And if you could please respond, that would be great. The options are nothing at all, a little bit, a good amount, but I want to know more. And I'm a CCO pro is the last option. So I'll give that a few seconds and see where you guys are. 10 more seconds. We have 61% of you have voted. Let's try to get a little bit higher. 63%. All right. 67%. Oh, 70. All right. Let me go ahead and I'll give it 2 more seconds and closing it. All right. So it looks like 36% of you answered a little bit and 61% of you answered a good amount, but I want to know more. Awesome. So as I mentioned, it took me quite a long time to wrap my head around what a CCO is. And then I started participating in some different groups that helped me. And this is some of the information we're going to cover was presented at those groups. So I'm going to share it with you today, and hopefully it'll help you the way it helped me. So first of all, what is Medicaid, or the Oregon Health Plan? If you've ever been asked that before, here's a nice little definition for you. Medicaid, or OHP, is a health insurance program for individuals and families who meet income criteria in addition to other eligibility requirements. Basically, it's funded jointly by both states and the federal government. It's overseen by the federal government, or CMS. You may have heard us use that acronym before, and that stands for Centers for Medicare and Medicaid Services. And that's operated, and then in addition to that, the state level, Oregon Health Authority, which our community partner program is now under. So just to also give you another picture of it, you'll notice the chart on the right-hand side of the slide. You've got the federal level, CMS, state level, OHA, Oregon Health Authority, and then at the local level, you have your coordinated care organizations. Small note here at the bottom, because CMS also includes Medicare. Medicare, however, is a health insurance program for elderly and certain disabled Americans, and that is completely operated by the federal government. So we're not going to talk about that today. We're going to focus on Medicaid, or the Oregon Health Plan. So what exactly is a CCO, or Coordinated Care Organization? I've seen a lot of different definitions. Some can get very long. I like this one. It's kind of in the middle. So basically, a CCO is a healthcare network of all types of providers, and they work together in their local communities to deliver patient-centered care for people on the Oregon Health Plan. And hopefully you can see the graphic there. I'm a visual person, so I like to see illustrations. So at the center, you have your member, your OHP member. And then you have all different kinds of providers, your counselors, your dentists, pharmacists, their primary care provider, their PCP, all working together for the OHP member, for their health. And what coordinates all of those providers, the entity that's responsible for that network, that is a CCO. And CCOs financially integrate to provide that coordinated care. And I just mentioned those different types of providers. This is, you'll see the bullet list there that shows the different types of services. We have physical health, behavioral health, mental health, addiction services, oral health, and other social services. So that, in a nutshell, is what a CCO is. It's that network of providers working together to coordinate an OHP member's health. And next, what do CCOs do? You may have heard the term triple aim. Well, here it is. This is what the triple aim is. This is what CCOs want to do, strive to do, and are doing currently. They want to achieve better health, better care, and lower costs. So CCOs focus on prevention. They focus on helping people manage chronic conditions like diabetes. And what this does when you focus on prevention and chronic conditions, it helps reduce unnecessary emergency room visits, keeps people out of the ER. If any of you are from a hospital, you know that unnecessary emergency rooms visits are not the way to treat people's health, their primary health, their preventative health. We want to reduce those unnecessary visits. Also, it gives people support to be healthy in a lot of other ways. Social services, you noticed on the last slide, it mentioned one of the bullets, social determinants of health, things like where people work, live, and play, all of those things are also addressed out of the ER typically. So why do we need CCOs? So we mentioned this, so we really want to hammer this in. They provide preventative care because that lowers costs essentially. When people's chronic conditions are managed, they don't have to get treated in an ER. They can go to a patient-centered primary care home, for example, where they're going to have that healthcare team who's going to be helping the person not only when they're sick, but hopefully prevent them getting sick. And then also better coordinated care limits unnecessary tests and medications. And then if you think about a patient-centered primary care home, typically they offer other services or they work with other local providers like somebody's dentist or counselor or addictions care. So this healthcare team all works together to hopefully keep the patient, the OHP member, as healthy as possible. And then also one of the key points here on this slide as far as person-centered care is that CCOs also work to increase health equity to ensure that everyone in Oregon has the care they need to stay healthy. Whether that's making sure that people have a culturally responsive health plan or the language that they need. And what are some of the key features of coordinated care organizations? The next few slides are a little bit wordy, but hopefully hang in there with me, and then we'll definitely have some times for questions. Just want to give you a heads up about that. So CCOs are locally governed to address community needs. They have one budget that grows at a fixed rate. CCOs are accountable for the health outcomes of the population they serve. And they are also governed by a partnership among healthcare providers, community members, and stakeholders in the health systems that have financial responsibility and risk. I mentioned I'm from Eastern Oregon. The CCO currently that we have is Eastern Oregon Coordinated Care Organization. And if you look up who owns them. You've got hospitals, you've got different health carriers. So all of those people are the ones that own that CCO and govern it. And so how does the money flow? It's important to know how they're funded, how that happens. So CCOs are not typical. If you maybe lived in another state, or if you're familiar with healthcare in another state, you probably haven't seen CCOs there. So basically what Oregon had to do was apply for a Medicaid waiver with the federal government in order to create CCOs. And basically what that waiver does, it allows OHA to have oversight of CCO activities. And also that waiver allows OHA to provide a global budget, or that money, to CCOs. And the global budget is a fixed per member per month payment to the CCOs based on program eligibility for your traditional Medicaid members. So basically, CCOs receive funding based on how many members they have. And so something else about the global budget to keep in mind is under that global budget, CCOs are at risk for the losses, and they're also rewarded for savings. And CCOs are allowed to keep those savings, and they also can reinvest those savings in prevention, promotion, and other health-related activities. And so how does OHA make sure that the global budgets are not abused? So if you think about your traditional insurance company, maybe think about the insurance you have through work. You pay a monthly premium, correct? So gathering the premiums and then not spending that money on patient care typically is how some carriers create their profit. They keep the premiums. So you can kind of think about the global budget similar to a premium. However, OHA withholds a portion of the global budget, and through incentives that are hopefully and they're believed to help the CCOs achieve that triple aim we talked about. If they meet those incentives, those metrics, then the CCOs can gain that money back. So OHA maintains or withholds a certain portion, and if the CCO meets the metrics, they can get that money back. Hopefully that's making sense, clicking for you a little bit more there. All right, so the big question is, how can you engage with your CCO? So I've got a couple of links here, and if you've never visited these pages, I highly recommend that you do. So the first link takes you to how you can find the CCO in your area. I'm going to go ahead and click on it, and hopefully you should be able to see my browser here. And so this page also gives you a definition. It has a little video here, but one of my favorite parts is it has all of the different CCOs that we currently have. When you click on a name, it gives you their website, their contact information, the provider contact for anybody that's a provider. This is very useful information. And it now also features their non-emergent medical transportation ride service. So if anybody is in the advanced health area, this is helpful information you're seeing. But you can see that for every single CCO, all 15 of them that we currently have in Oregon. All right, so you have the link in the slides there that we'll be sharing. Let's go back to the show. And so the next link I wanted to mention is how to find your local community advisory council. And this is a group that I referred to earlier when I said this is what helped me finally wrap my head around what a CCO is. I was involved with the Malheur Advisory Council, and I actually got to serve as the vice chair of the Malheur Local Community Advisory Council, and I really learned a lot about CCOs there. But this is where you can find where to get in contact with your community advisory council. So each CCO has that information. I'll just go ahead and click on mine, and there's the contact. And this is typically they meet monthly, and it's an opportunity for members to get feedback on how the Oregon Health Plan is working for them. What are some of the other things that are needed in the community? So these are two ways for you to engage with your CCO. How can your clients engage with their CCO? So CCOs are always looking for visitors or members to attend the local community advisory council meetings. Currently, LCACs, as they're called, local community advisory councils, have to have 51% of their members be OHP or Oregon Health Plan members. So you work with OHP members. It's a great way for you to know this information because LCACs are always looking for OHP members. This is a way for OHP members to voice their concerns or also voice what's working and what they don't want to change. So anytime that you can point members towards those local community advisory councils, I think it would be helpful. Also, some advisory councils have subcommittees, especially for members, things that engage members. And then also CCOs may have different opportunities. So for example, EOCCO provides transportation reimbursement. So when a member attends one of their monthly meetings, they get reimbursed for those costs. There's childcare reimbursement at EOCCO. There's usually lunch provided. So all of those little things, and I'm sure that varies by CCO, but it's not just show up, listen. There's benefits to it as well. Okay, and so what's next for CCOs? We've been very involved in what's now known as CCO 2.0, so the next iteration, the next wave of what CCOs will look like. You'll notice this green star here. That was when we first created this presentation. That's where we were. Now this orange star is more accurate to where we are. So this web page here as well that talks about CCO 2.0 has some good information, and right there the headline is that OHA received 19 applications for groups that wanted to be coordinated care organizations or CCOs from 2020 to 2024. So currently those applications are being reviewed, but in 2020, that is when we will see the new CCOs. Very excited about that. Our team was also on the ground meeting with different community members to let OHA know to provide feedback what they wanted to see in these next CCOs. So that was very exciting, and anybody that helped with that, thank you very much. That was very important to make sure that we got that member feedback. All right, so there it is. That's CCO 101.